Imagine sitting in the dentist chair, expecting a standard checkup, and instead being handed a treatment plan for an extraction, a bone graft, and an implant. Total cost $11,800. This is exactly what happened to Margaret, a retired maths teacher. She had carefully built a $14,000 emergency fund for home repairs. Suddenly, she faced a brutal choice: live with chronic pain and a deteriorating jaw, or wipe out nearly her entire life savings on a single tooth. Margaret had hit the retirement healthcare cliff. This is the exact moment when the employer-subsidized health coverage you relied on during your working years vanishes, precisely as your body's age-related maintenance needs begin to accelerate. In the next 5 minutes, we are going to map your actual healthcare gap and build a dedicated defense fund to protect your retirement savings from being cannibalized. Ignoring this cliff leaves your finances exposed to a sudden, catastrophic hit. But by actively planning for these inevitable costs right now, you convert a potential budget crisis into a routine, manageable expense. Step 1. Understand what you are actually covered for. When Medicare was established in 1984, dental care was deliberately excluded from universal coverage due to cost concerns and political compromises. This diagram of Swiss cheese illustrates exactly how Medicare operates. The solid cheese provides robust coverage for hospital emergencies and general practitioner visits, but the holes are massive, and they exist exactly where retirees need the most help: dental, physiotherapy, and specialist care. This cross-section shows the system's reality. Down on the ground floor, basic care is essentially free. But to get essential allied health services to maintain your mobility as you age, you have to climb the stairs and pay full retail price. Many retirees assume the public dental system acts as a backup plan. Public clinics prioritize severe social disadvantage and only offer basic, immediate interventions, like simple extractions. If you need comprehensive restorative work, like a bone graft or implant, you will be placed on a waiting list that can stretch to 18 months. By the time your name is called, the gap in your mouth will have caused permanent jawbone loss, making future implants physically impossible. Treating the public dental system as your retirement safety net carries severe medical risks. The only reliable strategy for maintaining your health and your dignity is private self-funding. Now that we know what Medicare doesn't cover, step 2 is calculating your true cost baseline. Most people make the mistake of looking at their medical spending from their healthy working years and assuming that number will stay flat in retirement. That assumption is dangerous. Researchers at the University of Melbourne tracked actual retirement expenditures over 7 years and found that Australian retirees consistently underestimate their out-of-pocket healthcare costs by a massive 68%. Healthcare spending follows a J-curve. Stable during your adult life, costs violently accelerate upward precisely at age 65 due to cascade spending. One uncovered medical gap triggers dietary consultations, which then leads to physical therapy. One expense breeds 3 more. To find your actual retirement healthcare liability, take your current yearly medical budget and multiply it by 1.68. Then add a dedicated buffer for inflation and unexpected procedures. Accurately forecasting this inflated, statistically proven baseline is the absolute prerequisite. Once you know the real number, you can build a structure to contain it before it collapses your household budget. Step 3 is isolating the money. A major strategic failure in retirement planning is mixing your medical emergency money with your general household repair funds in the same bank account. Mathematically segregate liabilities. Open a dedicated savings account named Medical Gap Fund. Set your target at $12,000 to cover a catastrophic dental implant. To hit that target, redirect a specific portion of your initial superannuation drawdown straight into this account. Seed this gap fund before you allocate any money to lifestyle expenses or travel. Locking this cash away for healthcare ensures the money is there when a crisis hits, converting a life-ruining financial emergency into a simple administrative inconvenience. Step 4 is establishing your backup plan. There is a period of high vulnerability when you first retire and your gap fund is still growing. You need a strategy if a medical crisis strikes during this window. If an infection hits before your fund is fully capitalized, use the public system strategically. Go to a local public emergency clinic solely for immediate infection control, pain relief, and basic extraction. Once the immediate danger is stabilized, shift to the private sector for the long-term restoration. Pre-research private clinics in your area that offer zero-interest payment plans. You can finance the actual implant over 12 or 24 months, while your superannuation continues to pay out. Mapping these triage and financing options in advance prevents you from making panicked, high-interest debt decisions while sitting in a waiting room in agonizing pain. You now have your defensive pillars in place. You have acknowledged your true cost baseline, you are actively funding a segregated gap account, and you have mapped a precise crisis backup plan. This is the system Margaret eventually adopted. When her next dental complication arose 2 years later, she didn't have to sacrifice her grocery budget or her peace of mind. She simply tapped a button and paid the bill from her fully stocked medical reserve. To start crunching your own baseline numbers, download the free gap calculator template linked in the description below. The healthcare cliff is invisible to most retirees until they fall over it. But by calculating your exact costs and building your defense fund today, you guarantee your financial security remains entirely under your control.